guys, welcome to the second episode of this Glaucoma Awareness video series. Today we have Dr. Vijaya with us here. Thank you so much, Dr. Vijaya. Let's jump right into the questions.
Yes.
We've got several questions, but the very first question that comes to my head is, Doctor, what causes glaucoma? And on top of that, who is at risk of getting glaucoma?
Yeah, to understand how glaucoma occurs, so we have to understand two parts of the eye. One is optic nerve and the fluid in the eye. So when the fluid is not flowing properly, when there is any obstruction in the fluid flow of the eyeball, then the pressure builds in the eyeball. That pressure causes damaging effects on the optic nerve. When the optic nerve getting damaged because of the high pressure in the eyeball, then the glaucoma occurs.
Okay.
So usually the people around 40 years and those who are diabetic, hypertensive, and those who are under medications like steroids, and if they got any injury that obstructs the fluid flow in the eyeball, may cause the rise in pressure and may lead to glaucoma.
You have mentioned about people who are taking steroids or who are on medication, who's having sugar problems in their health. Then how can glaucoma be prevented? I mean, these are people in their lifestyle, they take these medications.
Yeah.
How can it be prevented?
No, actually we cannot say it can be prevented, like how we prevent some things with the vaccines. We cannot prevent it, but we can do early diagnosis.
Okay.
So when the patient with these problems, if they come to the clinic, like we can do the screening. So we can check the pressure, whatever the screenings are needed, like visual fields and all. We can do the screening and we can diagnose them early before their nerve gets damaged. So we have to diagnose and start the treatment so that we can preserve the patient's vision.
Okay. If you are then diagnosed with glaucoma, what are the treatments that, for example, eye care also provides? What are the treatments?
Yeah, actually for glaucoma, it's basically medical treatment. So the medications we usually use are the eye drops. Those are the long term. Usually we say lifetime, you know.
Yeah.
So if the medications are not working properly, then we may add the tablets. So that is usually for short term.
Okay.
So even these two things are not working, there are some certain special cases, like something called angle closure glaucoma.
Okay.
In such cases, we have to give some laser to them. So everything is to make the flow better in the eye. Okay, then very rarely, if everything is not working, then we may have to go for surgery. But usually patients will respond with the medication and laser and tablets and all.
Okay. How often, for example, should I check my eyes?
No, for a glaucoma
Yeah,
patient?
yeah.
Yeah. So usually in the beginning days, the follow-up should be more, because we have to understand the patient, we have to understand how the patient is responding to the treatment, what exactly happening to the eye. So we may call the patient in a frequent visits for sometimes 15 days, 1 month, 2-3 months, like that. So once the pressures are stabilized, when we understood the patient is under control, so then we can call them yearly, or 2 yearly checkups are enough. But here in Maldives, people have a habit of carrying the medication for 3 months. So here usually we call them to come for 3 months.
Oh, thank you so much, Dr. Vijay. That's a lot of information, and I hope the public also gained a lot of knowledge with me here. Thank you so much. We'll be back with the third episode next week.